Welcome back. We are on Chapter 23, Allergic Reaction. Topics we're going to discuss are going to be allergic reactions, self-administered epinephrine, or EMT-administered epinephrine. All right, let's talk allergic reactions. All right, we'll start with allergic reactions. So to start with, the immune system naturally responds to foreign substances in the body in order to get rid of them. So an allergic reaction is actually an exaggerated immune response, where an allergen is a substance that causes an allergic reaction. Next is anaphylaxis, or what's called anaphylactic shock. This is a severe, life-threatening allergic reaction. So the blood vessels dilate rapidly, causing a drop in blood pressure, which is also known as hypotension. So the cells leak fluid into the interstitial space. The tissues then swell, and it also includes the airway. So you have to be very careful with these patients that you're watching their airway very, very closely. Causes of allergic reaction can be insects, so like bees, yellow jackets, wasps, and hornet stings. Foods can include nuts, eggs, milk, and shellfish. Plants can be poison ivy, poison sumac, and poison oak. Medications, a lot of the times you'll see penicillin, amoxicillin, stuff like that. And then other allergic reactions can be from dust, chemicals, soaps, makeups. Sometimes things with different scents make people's skin react and whatever else. Okay, and just to remember that the substances that may cause allergic reactions are insect stings, plants, food, and medications. Latex allergy is of particular concern in EMS because many patients have latex sensitivity. So patients who have had multiple surgeries are increasingly likely to have this allergy. So wearing latex gloves while providing patient care can cause a reaction to them. So providers can also develop a latex allergy from the prolonged exposure. So a lot of gloves that you see nowadays are considered latex free. So just remember that if you're stocking your gloves and whatever else, make sure that they are latex free gloves, because you don't want them to either have a reaction with the patient or even with yourself or your coworkers. An allergic reaction does not occur the first time a person encounters the allergen. So people have that misconception that if they're stung by a bee at the age of 25 years old, that they've never been stung by a bee before. You have to have been exposed to it first. So on your first exposure, the immune system forms those antibodies. And then on the second exposure, the antibodies combine with the allergen. And then this causes the release of the histamines. And then these substances lead to a spectrum of multiple other reactions. So just like medication, you may have taken amoxicillin when you were 5 years old, and now at 25, you need to take amoxicillin and you became allergic to it. Or if you've been stung by a bee at the age of 5 and you forgot about it, and now at 25, you got stung by a bee and you're allergic to it. Well, how did that happen? Because you had to be exposed at one point. More than likely, you were exposed at some point in your life to that you just don't remember. So just like eating peanuts or peanut butter or even shellfish. Some people will eat seafood for many, many, many years, and then all of a sudden one day they become allergic to it. So that's why you have to have been encountered it at least once before you're allergic to it. But you could also experience it multiple times before you become allergic. The spectrum of allergic reactions include dilation of the blood vessels, which reduces the amount of blood that's returned to the heart. The next one is flushing of the skin as blood vessels near the surface to open up. And then development of the angioedema as fluid moves into the tissues, and then swelling around those vocal cords. And that's the part that you have to be sure that you're ready to go on that one if they do have that swelling around the vocal cords, because it can close off their airway. Then you have the development of urticaria, which is hives on the skin, the bronchoconstriction that decreases air movement in the lungs, and then the development of thick mucus within the lungs. The exact course of an allergic reaction is unpredictable. So a severe reaction may be immediate, but it can also be delayed by 30 minutes or more. A mild reaction can rapidly progress to anaphylaxis. So you always want to be sure you're ready to go with epi or Benadryl or whatever you're able to carry per your local protocols. You want to also closely monitor any patient exposed to a known allergy. Signs and symptoms of an allergic reaction on the skin are going to be itching, hives, flushing or red skin, swelling of the face, neck, hands, feet, or tongue, and warm, tingling feeling in the face, mouth, chest, feet, or hands. Here are signs of an allergic reaction which may cause facial swelling. Signs of allergic reaction may also include hives. So some signs and symptoms you're going to find in the respiratory system is going to be tightness in the throat or the chest, a cough, rapid labored and or noisy breathing, hoarseness, muffled voice, or loss of voice. They could have stridor or wheezing, and it might be audible without even having to use a stethoscope. Signs and symptoms of an allergic reaction in a cardiac system is going to be they're going to have increased heart rate and their blood pressure is going to decrease. Your generalized findings are going to be probably itchy eyes, watery eyes, headache, running nose, and a sense of impending doom, like they feel like they're going to die. And they may even say that. Signs and symptoms of shock, because you know that patients with an allergic reaction could potentially go into shock. So they might have altered mental status, flushed, dry skin, or pale, cool, clammy skin. They might have nausea and vomiting, or changes in their vital signs. So they could have increased pulse and respirations and decreased blood pressure. So remember, when we're talking about shock, that last one, the changes in vitals, that's going to be probably one of your first indications besides the altered mental status that's going to tell you that that patient is in shock. So when their blood pressure goes low, their pulse increases and respirations increase, that is a very good indication that your patient is going into shock. Next, we're going to talk about allergic reactions, distinguishing anaphylaxis from a mild allergic reaction. So any of the previous signs and symptoms can be associated with an allergic reaction. To be anaphylaxis, though, the patient must have either respiratory distress or signs and symptoms of shock. So that's when it's going to take it from an allergic reaction to an anaphylaxis. So respiratory distress or signs and symptoms of shock. All right, so now put your patient in front of you and we're going to do a patient assessment. So the first thing you're going to do is perform a primary assessment and care for any immediate life threats, including the ABCs. So during your secondary assessment, you want to inquire about a history of allergies, what the patient was exposed to, how the patient was exposed to it, the route of exposure, signs and symptoms, progression, and any interventions you did. You want to assess their baseline vitals and obtain the remainder of the past medical history. So you want to suspect an allergic reaction when the patient has come in contact with a substance that has caused a reaction in the past. The patient complains of itching, hives, or difficulty breathing, and the patient shows signs or symptoms of shock. All right, so patient care for an allergic reaction is going to be first and foremost managing the patient's airway and breathing. You will apply high concentration of oxygen if the patient is in distress or appears to be in anaphylaxis. So that means a non-rebreather, high flow O2, meaning that 10 to 15 liters per minute. Again, if that bag collapses, you want to increase that oxygen. Okay? If the patient has or develops altered mental status, you want to open and maintain that airway. If the patient is not breathing, then you're going to adequately provide artificial ventilations with that bag valve mask. Okay, and as soon as you get oxygen, hook that bag valve mask up to it as soon as possible. Next, you want to determine whether assisting the patient with an epinephrine autoinjector is appropriate. You're going to consult medical direction regarding the use of the autoinjector when the patient has come in contact with an allergen and either has respiratory distress or signs of shock, is not wheezing or showing signs of respiratory distress or shock, and complains of respiratory distress or shows signs of shock but does not have an autoinjector available. Again, this is nationwide, so remember you're always checking your local protocols. But for this purpose, you are listening to what this says for the written test. Okay? So after using an autoinjector or administering epinephrine from the ambulance, you want to make sure that you record the administration of the epinephrine, transport that patient immediately, and reassess after 2 minutes. If the patient meets the criteria for the epinephrine, but you cannot carry and use it, you want to call for that ALS intercept as soon as possible. After administering epinephrine, perform a reassessment, paying special attention to the patient's ABCs and vital signs en route to the hospital. In this section, we're going to talk about self-administered epinephrine. Okay, next we're going to talk about self-administered epinephrine. So as a medication, epinephrine constricts the blood vessels and dilates the bronchioles. It is often prescribed to patients with a history of an allergy. Autoinjectors are carried or kept at home by the patients. And autoinjectors are spring-loaded needles and syringes with a single dose of epinephrine in them. They come in adult and child sizes. So remember, when you're giving or administering an epinephrine pen, you have to make sure that you leave it in for, you're going to administer it in that upper thigh area, and you're going to leave it in there for at least, 5 to 10 seconds so it has time to get all of that medication out. Once you administer it, then you make sure you take that and put it in a sharps container right away. Here's what the epinephrine autoinjectors, the junior and the adult one, look like. If authorized by your medical direction, you can administer epinephrine from an autoinjector prescribed for the patient. So that would be the patient's prescribed epinephrine pen. Some states will even allow EMTs to carry autoinjectors on the ambulance to administer with medical direction approval. But always be sure, again, you're checking your local or state protocols. When you administer an autoinjector, you're going to first check the expiration date. You want to ensure that the liquid is clear. You're going to remove the cap and press the injector firmly against the outer thigh, midway between the waist and the knee. You're going to hold it in place until the entire dose is injected, which again is roughly that 5 to 10 seconds, and then reassess them after 2 minutes. The pulse will likely increase after you give epinephrine because epinephrine is like adrenaline, and then symptoms will likely decrease. If they don't decrease, that's when you may need to give them another one, but you may, according to your local protocols, may have to call into medical direction before you give them that second one. Epinephrine may be dangerous for a patient with a heart condition or one who is hypertensive. So traditional thinking held that EMTs should only deliver epinephrine to patients with prescribed autoinjectors. So now that thinking has changed. Many systems now allow the EMTs to carry and administer the epinephrine in certain conditions. So again, going back, follow your local protocols to what your medical director says is okay. Patients with prescribed autoinjectors may be uncomfortable or afraid to use it without help. So in general, always inject directly through the clothing when assisting that patient. Check your local protocols again for variations to this general rule. You want to carefully monitor the patient's airway and breathing throughout care and transport. If the patient's condition deteriorates, you may need to give additional doses. This requires bringing the patient's additional autoinjectors in the ambulance. You must obtain permission from medical control for any additional doses. Again, going back to your local protocols to make sure you know what you can and can't do. In this section, we're going to talk about the EMT administered epinephrine. All right, so we talked about the autoinjectors for the patient. Now the EMT administered epinephrine is a little bit different. So the EMS systems that allow EMTs to administer epinephrine have moved to using hypodermics and syringes. Okay, so it's not a pre-filled, pop it in the thigh and move on. This one you actually have to draw up the medication. So it's called the ready, check, inject method is commonly used. So only 1 ml of epinephrine is carried in a vial or an ampule. Okay. A second provider must verify that dose being drawn up. So it's 0.3 mLs for adults and it's 0.15 mLs for children. Intramuscular needles and syringes are used to do this. So make sure you have the right needles and you know and understand how to draw up 0.3 mLs for adults and 0.15 mLs for children. And always, always, always have it verified by a second person. So supplies are packaged in a single container with a review card. EMTs they must be trained to use this kit, and they must demonstrate competency in that technique before they're allowed to do it. And then the agency that you work for must maintain records of your training, because if there is ever an issue, a situation, a lawsuit, whatever, they have to record that you have taken this training, you know it, you understand it, and you have completed the necessary process to be able to inject it. If your system uses Ready, Check, Inject, you must complete these steps in order to be authorized. You should also be familiar with your system's protocols, including the need to obtain online medical direction. So remember, online medical direction is where you pick up the phone or the radio and you call into a live physician who will tell you what to do on the radio or the phone. So that's online medical direction. All right, let's do a quick chapter review. Allergic reactions are common. Anaphylaxis is a true life-threatening allergic reaction, which is rare. The most common symptom in these cases is itching. Patients with anaphylaxis, though, will also display life-threatening difficulty breathing and/or signs and symptoms of shock or hypoperfusion. These patients will also be extremely anxious. Their bodies are in trouble and are letting the patient know it. The signs and symptoms of anaphylaxis are a result of psychological changes: vasodilation, bronchoconstriction, leaky capillaries, and thick mucus. By quickly recognizing the condition, consulting medical direction, and administering the appropriate treatment, you can literally make the difference between life and death for these patients. Remember, in an allergic reaction, the body's immune system overreacts to an allergen and causes potentially harmful side effects. Anaphylaxis is a severe systemic form of an allergic reaction. It is a life-threatening emergency. EMTs must use assessment to differentiate a localized allergic reaction from a systemic anaphylactic reaction. Epinephrine is useful in anaphylaxis because it constricts dilated blood vessels and opens bronchial passages. Epinephrine has potentially dangerous side effects and should be used only in the event of an anaphylaxis. Next, we'll talk about questions to consider. What are the indications for administration of an epinephrine autoinjector? List some of the more common causes of an allergic reaction. List signs or symptoms of an anaphylactic reaction associated with each of the following: one with the skin, one with the respiratory system, and one with the cardiovascular system. Next, critical thinking. A 24-year-old male ate a meal that he believes contains shellfish. He is allergic to shrimp. He is sweating and nervous. He appears to be breathing adequately. You do not note any wheezing or stridor. His face is slightly red. His pulse is 88 strong and regular. Respirations are 24. Blood pressure is 108/74 and skin is warm and moist. Should you administer epinephrine? As always, if you have any questions, please reach out. Thank you and have a great day.